Thank you all so much for being here today, and to our amazing team from the Primary Health Network. And officially welcome. Thank you for joining us today for Growth Under Pressure, one FQHC's Organizational Resilience Transformation. My name is Foster Noon, and my pronouns are they and them. I'm the project coordinator and specialist for the NHSC Empowerment Initiative and at the Association of Clinicians for the Underserved, and I'll be your moderator today. Feel free to type your name and location in the chat so we can see who's here. This is our 16th and final webinar in our 2024 National Health Service Corps Empowerment Initiative, Advancing Clinician Wellness and Health Equity. We've had an amazing lineup this year, and if you've missed any of our 2024 webinars, you can find those recordings and slides on the initiative's webinar page. This HRSA initiative was designed to help NHSC participants and new clinicians in the field prepare for and succeed in serving patients in health professional shortage areas. Our two main goals are to equip NHSC participants with the information they need to succeed as they enter the workforce and begin caring for patients with complex medical needs and barriers to care, and to guide NHSC-approved sites in their efforts to support clinician well-being and create a work environment that is efficient and adapts well to change. So today's webinar is the fourth and final part of our Organizational Resilience mini-series. And thank you to everyone who has joined us for the first few in the series and throughout this year. Moving to the next slide, when we talk about organizational resilience here, we're talking about an organization's ability to continue to function in the face of adversity, not just surviving, but adapting and transforming to meet challenges. These three facets of resilience here, planned, adaptive, and everyday, all require serious commitment and infrastructure. And so moving to the next slide, in our past three webinars, we were really excited to highlight the National Academy of Medicine's 6 domains of evidence-based and promising practices shown to increase clinician well-being: organizational commitment, workforce assessment, leadership quality, policies and efficiencies, social support, and team-based care. And in each of those webinars, we got to do a deep dive into what those elements look like with amazing presenters in our field. If you missed parts 1 through 3, you can check those out on our initiative webinar page. The whole recording and PowerPoints and stuff are there as well. But today, for our final webinar of the year and the culmination of this series, we are so excited to be joined by leaders from the Primary Health Network in Pennsylvania to learn about how their organization grew and adapted in the face of stressors, both unique to PHN and universal to FQHCs, who are still reeling from COVID's impact on healthcare delivery. Next slide. You can see all of our lovely presenter faces. It has been a really incredible experience working with the Primary Health Network team in creating this Grand Round presentation for all of you today. The array of programs and institutional supports that they have created for their staff is phenomenal. And coming from an FQHC background, it is really an honor to witness this type of care and intentionality for the career paths of staff at all levels of community health centers. When you value, support, and invest in your staff, both your workplace and the care you provide to your community can blossom in really beautiful ways. And I'm excited, so excited to have you all here today to share the work you've been doing with such amazing folks across the country who are here to learn. So introducing our amazing speakers today, we have Dr. George Garrow, Tina Adamson, and Jesse Miller, all from the Primary Health Network. Starting with Dr. Garrow, Dr. George Garrow is the Chief Executive Officer of Primary Health Network. He joined the organization in 2016 as Chief Medical Officer, where he has led efforts to enhance patient care and improve the overall quality of services provided at the health center. George earned his medical degree from the Pennsylvania State University College of Medicine in Hershey, Pennsylvania, and completed his internal medicine residency and chief residency at Presbyterian/St. Luke's Medical Center in Denver, Colorado. He then pursued medical oncology fellowship at Vanderbilt University in Nashville, where he was recognized as American Cancer Society Fellow. Prior to his current role, he served on the faculty at both Vanderbilt's University Medical Center and the University of Rochester Medical Center before returning to Pennsylvania in 2001. George holds board certifications in internal medicine, medical oncology, and hospice and palliative medicine. Welcome. Tina Adamson is the Chief Human Resources Officer at Primary Health Network. She became part of the Primary Health Network team in April of 2012. Tina holds a Bachelor's of Business Administration from Kent State University in Kent, Ohio, and a Master's in Business Administration from the University of Phoenix. Additionally, she is a certified professional in human resources. And last but not least, Jesse Miller is the Director of Human Resources at the Primary Health Network. She became part of the Primary Health Network team in May of 2017. Jesse holds a Bachelor's of Science in Human Resources from Westminster College in New Wilmington, Pennsylvania. Additionally, she is a Society for Human Resource Management, SHRM, certified professional. Thank you so much for all of you for joining us. We're so excited to hear from you today. Before I turn it over to our amazing speakers, I want to let y'all know as the audience that will be plenty of opportunities to engage with our speakers and fellow attendees throughout the presentation through polling, the chat box, and raising your hand to speak. Please make use of those opportunities to interact with one another today. We're very excited to hear from y'all as well. And before I hand the mic over to get us started, I'm going to go over a few housekeeping items. This webinar is being recorded, and a link to the recording will be emailed out to you within 2 days. The PowerPoint slides for today can be found on the webinar registration page, which has already been linked to in the chat, as well as a direct link to the slides. And again, if you've missed any of our previous webinars, you can find those slides, recordings, and transcripts on the same webinar info page. We'll have time for Q&A at the end of each part of the presentation, and we'll also ask you some questions throughout that should spark some conversation. Please type any questions you have in the Q&A box, which can be found at the bottom of your screen. If you're having a technical assistance question, please contact our colleague Josh, who is the person behind the NHSC Initiative Zoom account today. And he also just popped his contact information into the chat. So we're going to be using the Slido platform to ask questions throughout today. And you have two options for how you can respond. The first is to open your cell phone camera to follow the QR code here on the screen, and then entering the password, that letters and numbers down at the bottom, to access this specific presentation. You also can manually navigate to the Slido website by using the link provided, and then enter both the numeric code and the password to come to this presentation's questions. Once you've opened the Slido, it will automatically update with the next polling question as long as you keep the window open. So you should only have to open it up once. And we would love for y'all to open it now, get a feel for it, and so you'll be ready for questions throughout the presentation. And our first question is, what is your role in relationship to the National Health Service Corps? And I see folks are beginning to fill it out. Amazing. Got some NHSC points of contact, some HR staff, a current NHSC LRP participant in the fields. Amazing. Oh, and there was an ask for us to post the Slido link into the chat. We can do that just a moment. And yes, I see we have a wide array of points of contact, C-suite staff, current participants. Amazing. And I just popped the Slido link in the chat. You'll still need to type in the number and password, but that should take you right to the site. All right, thank you to everyone who has filled out the poll. We really appreciate you participating, and we would also really appreciate your feedback on today's session. So if you can, please complete our survey at the end of the webinar to let us know how we did and how we can improve our trainings. We'll open that up towards the end. We'll also be plugging our end of year survey to get feedback on kind of this entire year of webinars. So we're excited to share that with you as well. And finally, if you need closed captions today, you can click on the CC icon or where it says show captions in the bottom of the webinar window, and those will generate automatically. All right, I'm going to turn it over to George. Thank you all for being here. Can't wait to hear this presentation.
Well, thank you, Foster, for your kind and welcoming introduction. And thank you, everyone, for taking time out today to join us on this discussion. With the next slide, I have the opportunity to share with you today's learning objectives. After participating in today's session, we hope that you will be able to understand Primary Health Network's growth and implementation of our workforce system change. We also hope that you'll be able to recognize examples of the leadership commitment necessary to promote organizational resilience, and importantly, to identify opportunities for new programs and policies at your organization. Next slide. So here's another Slido poll. If you could take a moment to answer, do you work at a community health center?
And we'll give it a minute. We know it takes a moment to get back to the question, but I see in the chat, yes, there are folks at a community health center. We know from registration that a lot of folks are coming from community health centers, and our Slido might need another click to show those results. Oh, no. All right, well, it is not forthcoming with this data, but I think we know from registration and from our community of practice working with the National Health Service Corps that community health centers really are the core, not only of service delivery, but of the community that supports NHSC participants. And we are excited to be in this space with y'all and to be working with a great community health center like the Primary Health Network. And I think we can move forward into the presentation. We'll see what we can fix with the Slido.
Okay, that's great. Well, for those of you who are colleagues and friends working at other community health centers, thank you so much for the great work that you do serving our communities. Obviously, I think many of you are familiar with the power of community health centers, but I always think it's a good opportunity for us to reflect back on the very beginnings of the health center movement in this country. As I'm sure you're all aware, the community health centers were first established in the 1960s as part of President Lyndon Johnson's War on Poverty. Since that time, community health centers have grown to be the largest providers of primary care in the country. Last year, more than 30 million Americans received high-quality care at community health centers like mine and like yours. And I think what distinguishes community health centers from other healthcare providers is our commitment to removing barriers to care. We are committed to serving communities that otherwise confront financial, geographic, language, cultural, and many other barriers. And again, I think that's what separates us and makes us such a very unique part of the healthcare landscape. Next slide. So despite the evolving healthcare landscape, particularly over the last several years, I'm sure you will agree with me that the very core mission of community health centers remains unchanged. Organizations like Primary Health Network continue to uphold these principles by offering comprehensive services to everyone in our community, including underserved populations, to prioritize community engagement that involves healthcare decision making, and to advocate for policies that advance health equity and access to care for all. Next slide. So the next Slido question, Foster, if you can help me with this, what is something that you value about the community health center model?
Yes, hopefully our results will be popping up. But something we want to know from y'all is, what is something you value about the community health center model? I know for me, in working at a community health center before I was in this more national support role, something I really loved was that we were really meeting our patients where they were, regardless of their ability to pay. That felt really powerful to be able to say, like, all right, wherever you're at with insurance, with coverage, like, we are here for you and we'll be care providers. And yeah, well, we're still waiting to hear from folks. Do any of our facilitators want to share kind of what especially speaks to them about community health centers?
Sure. While the folks are typing, I can tell you my own personal journey. As Foster had mentioned, I sort of had a long and convoluted path to arrive at a community health center. But when the opportunity came for me to join Primary Health Network in 2016, it was really a fulfillment of everything that I went to medical school to do. I really believe very, very deeply in the mission of service, particularly to those individuals in the community that may not have had all the advantages and blessings in their life that I have been blessed with. And very commonly, if someone had asked, and sometimes even if they didn't ask, I would say that serving at a community health center was the very best job that I've ever had. And I still feel this way every single day. When I walk to my car at the end of the day, I think to myself, wow, look what we did today. Really having an opportunity to make a difference in people's lives.
Amazing. Thank you so much. And we're having some issues displaying them on the screen, but I was able to open up and see some of the great answers that y'all have shared. Someone wrote, able to spend the time needed to listen and support complex cases as something you value. Another person wrote, accessible healthcare for the most at-risk populations. Its history of inclusion and community empowerment. Just access. Yes, absolutely. Giving access to patients, another person wrote, and the diversity in the patient populations that are served. Amazing. Thank you so much, y'all. And we should have fixed the questions moving forward. Thank you all for your patience.
Okay, next slide. So just a little bit about Primary Health Network. Primary Health Network was founded about 40 years ago here in Western Pennsylvania. For many of you who may know, the economy of Western Pennsylvania underwent a dramatic upheaval in the early 1980s with the departure of the steel industry and closure of mining, which were really a backbone of many of the communities in our area. The founders of Primary Health Network really saw an opportunity to bring the health center model, access to care, to communities that were really struggling at the time. Over the last 40 years, Primary Health Network has grown from one little office here in Mercer County on the Ohio-Pennsylvania border. We are now the largest community health center in Pennsylvania and one of the largest in the country. Last year, we serviced over 75,000 patients in 16 counties in Western Pennsylvania and one in northeastern Ohio. On the map that's shown there to the right, you'll see the dark counties are those counties in Pennsylvania where Primary Health Network has a location. And the lighter green counties are counties that are in our service area, and we're honored to serve individuals from those areas as well. For those of you who may not be familiar with the geography of Western Pennsylvania, Philadelphia sits on the very eastern side. Pittsburgh sits on the western side. And the green counties where Primary Health Network is located is largely rural and largely Appalachian. We have over 140 prescribing providers, as well as over 520 support members on our Primary Health Network team at this time. Next slide. So this is a picture of our administrative headquarters, which is located in Sharon, Pennsylvania. We offer a wide variety, comprehensive range of healthcare services to try to meet the diverse needs of our community, and those are listed for you here. I'm proud of every single service that we provide. They're like my children. I love each one individually. I'm particularly proud of the great work that we're doing in response to our community's needs, providing behavioral health services, obviously preventive care, and we're going to talk in a little bit about some of our response to the needs of our community by enhancing our mobile health team. Next slide. So the mission of Primary Health Network is to enhance the health and well-being of the communities that we serve by fostering trust, ensuring inclusive and equitable access to healthcare that is both compassionate and exceptional. We envision a future where healthcare is a transformative, personalized journey that embodies a comprehensive approach marked by unwavering integrity, deep respect for diversity, continuous innovation, and a relentless commitment to quality. Next slide. We recently revisited and revamped our core values. What makes us Primary Health Network? And we have settled on iris. Iris is a flower which really signifies a rebirth and a re-beginning, a new beginning. And that really defines Primary Health Network. We were at an inflection point a couple of years ago as we were coming out of COVID and some of the other challenges that the healthcare community faced. And we really doubled down on the four letters in the word iris: integrity, where we want to adhere to the highest ethical standards, ensuring transparency and accountability, safeguarding patient trust, and fostering a culture of honesty. We believe very deeply in the importance of respect. We value diversity and inclusivity, and we treat everyone with dignity and respect, honoring everyone's unique perspectives in a workplace that encourages open voices and autonomy in healthcare decisions. We really want to lean into innovation, where we embrace a culture of continuous improvement, actively seeking creative solutions through cutting-edge technology and research to adopt to an evolving and ever-changing healthcare needs of our community. And last but not least, service. Service excellence is our priority. We want to go the extra mile and offer compassionate and personalized care to meet patients' healthcare needs to exceed their expectations and at the same time enhance the well-being of our community. Next slide. So much like many of you that work in community health centers, we have a strategic planning session with our amazing and very supportive board of directors. And we established the following 5 goals as our strategic goal for the 2023 to 2025 timeframe. 1, to foster a just culture. Number 2, to maintain fiscal prudence and to be good stewards of the resources that we're given. To 3, to shout from the top of the highest mountain to promote the mission, not only of Primary Health Network, but of community health centers in general. Number 4, to serve and meet the needs of our community. And number 5, to faithfully adhere to ethical practice and compliance standards at all times. Next slide. So next, I'd like to describe the shifting models of care as we move from COVID to where we are today and beyond. So the next Slido question, Foster, if you can help me with this. How have the healthcare needs of the patients in your community changed over the last 4 years?
And in this question, we want to know not just like generally how the landscape was changed, but are there any specific events that are specific to your community that have changed the way healthcare looks? So for me, being based in New Orleans, obviously COVID hit our community very hard. And when Hurricane Ida hit, that damage to buildings, to people's homes, being out of power for over a week, that was an event that really changed the health of a lot of people in our communities and is something that the city is still healing from and is impacting people's healthcare needs. So we're interested in the whole range of what's going on in your community and what's changed.
Hi, Foster. If you don't mind, I think I'm going to stop sharing the slides real quick to see if I can fix the Slido issue.
Sounds good. Would anyone like to share their answer in the chat?
I think there are some that have come in if Josh can, or if you can take a look. Sorry about that.
Just a moment, sorry. Yeah, okay, so I see folks shared an increased need and demand for behavioral health services. Absolutely. And more acceptance and interest in telemedicine across generations. Yes, absolutely. I was working at an FQHC that had never utilized telemedicine when COVID hit, and we made that pivot very quickly and with many rocky steps. But yeah, I think kind of across the board, we're seeing that the new infrastructure that had to be built for telemedicine is continuing to really benefit folks. All right, and thank you for everyone's patience as we've had a little bit of technical difficulty on our end. And I think we can just move into, oh, and I see another person shared. Thank you for sharing this, Josh. Our community has seen an influx of Spanish-speaking families as well as Spanish dialects, and we work to provide equity to these children by aiming to hire as many Spanish-speaking staff as possible, partner with local entities to offer interpretation, not necessarily a COVID result, but an influx we've seen in the last 4 years. Absolutely. Thank you for sharing.
Yeah, thank you for sharing. Another perspective that I can share personally, and it was probably there in our community prior to COVID, but it really, I became acutely aware of it, especially during the height of the pandemic, and it continues to be an issue in that we're really trying to understand with compassion. There are many communities within our community that have plenty of reasons to mistrust public health authorities, to mistrust, any person in an authority position. And so a lesson that I have learned is to lead by listening and to be seen as a trustworthy source of information and an organization or a provider or a person that hopefully I can earn the trust of the patients that we're honored to serve. So it was probably something that was there, but only became much more magnified, or at least to my awareness, as a result of COVID, is the importance of trust. So in that regard, and I'm sure many of you, since you're already working in the community health center sphere, know the importance of addressing social drivers of health. And this is actually some data from Primary Health Network that from 2021 and 2022, and it's really consistent even through our 2024 survey for social drivers of health. One of the things that, naively I thought was going to be a main driver barrier for folks to achieve optimum health. I thought it would be transportation, perhaps, or food insecurity or housing insecurity. And obviously, those are all really important factors for us to address. But you'll see in red on the 2022 slide on the right, and a thing that really popped up and has continued to be a major concern in our communities is social isolation and loneliness. One of the things that was an outcome of pandemic and COVID is we really shifted to telemedicine. We really shifted to virtual care. Even though many of us are on our devices all the time, that isn't necessarily a way to connect with individuals on a personal level. And we've really seen a continued or a persistent concern with loneliness and social isolation. So I'm actually very proud to talk about an initiative that our team has helped me to kick off. You may be familiar with an international movement called Sacred Places, where organizations are putting benches in locations where perhaps even intergenerational relationships can occur. Just sit at the bench and make a friend and talk to a stranger. And so we're actually having a ribbon cutting later this week for our first buddy bench in an attempt to try to help understand and address loneliness and social isolation. Next slide. The other thing that I am really proud of the work that we've been doing here at Primary Health Network, and I think it's really energized our team when we talk about a resilient health center, is that we've really focused on ways that we can come together collectively to improve the health outcome in our community. And you may be familiar with the Robert Wood Johnson Foundation, and they put out an annual ranking of county health outcomes, county health rankings, as well as a roadmap to improve the health of the communities that we're honored to serve. And this graph actually is a depiction of what are the factors that go into those health outcomes and those health factors. On the next slide is actually a depiction of the health outcomes in Pennsylvania. Now, if you think back to the slide I showed just a few minutes ago of the footprint of Primary Health Network, and the darker green counties are areas where we have a health center. On this particular slide, the darker the green, the worse the health outcome, the lower the health outcomes in those communities. And you'll notice that there's a significant overlap between the dark green counties on this map as well as the one that I showed earlier. And we really see this as an opportunity for us to engage with stakeholders across the spectrum, perhaps organizations that are involved with direct healthcare, but perhaps other social service agencies. How can we come together to think differently about what is health, and how can we work collectively to improve the health and the well-being of the community that we're honored to serve? Next slide. And it's time for another Slido question. How has healthcare delivery in your community changed in the last 4 years?
Hopefully, fourth time's the charm. Thank you all again for your patience with this. The poll should be activated and able to present your information on the screen. And if not, my colleague Josh will paste your answers into the chat. And y'all are also welcome to put your answers as a chat to everyone or just to hosts and panelists, and I can read them out that way as well. So in terms of delivery, I know we talked about the shift to telehealth and telemedicine becoming much more available. And I know something Dr. Garrow is going to share in a minute is, I think, mobile units really especially had their time to shine during the pandemic, and the use of those units has continued to become a part of care. I see someone shared telehealth. Someone said merger and acquisition of local hospitals and a closure of a community hospital. Yes. So thinking about delivery in the context of closures and loss of healthcare resources, that's a big one. Someone says they have started and run monthly community outreach days with food and local resources provided. You started a weekly farm produce market that is free or donation based, and started a healthy lifestyle cooking class for patients. That's amazing. If the person who shared that wants to share in the chat what organization you're with and where you're located, that sounds like an amazing resource. I'd love to know more about it. But all right, I think we can move into hearing more from Primary Health Network.
Yeah, thank you. Great. I have to say, I love the work that you're doing with healthy access to healthy food and the farmers market. And that's awesome. I love that. Keep up the great work. So one of the things that Primary Health Network was very fortunate to receive some additional funding during COVID was to enhance and expand our mobile health services. We were able to purchase the mobile health unit that you see there on the slide with some COVID funding. And during the height of the pandemic, we were able to deploy our mobile unit to do testing as well as vaccination and to deliver antiviral therapy in communities. As I mentioned earlier, we serve a very rural community, and sometimes the distance to get to a healthcare provider was a challenge. And so we really committed to making sure that everything related to our response to the pandemic was available, accessible, and adaptable to the unique needs of our community. As we sort of moved into a different part of what is COVID, we were able to return the mobile health unit to the manufacturer and now have it retrofitted so that it is a full service mobile health clinic. We're able to provide comprehensive dental, primary, behavioral health, and specialty care. And with this, we've been able to help bridge healthcare gaps, to promote equity, as well as optimize health outcomes. The other important thing that we have done with our mobile health unit is in response to the opioid crisis in our community. And we are currently taking our mobile health unit out to those communities in partnership with substance use treatment facilities to provide harm reduction, to offer food, or let us take a look at your wounds, or, again, to be able to earn the trust of the individuals in the community. Have we lost our slides?
It seems that we may have. I will get those pulled back up, and I see that Sandra in the chat shared that they work for Esperanza Healthcare in Philadelphia, and they are the amazing organization providing those farm produce markets. And we are getting the slides pulled back up. Sorry,
Okay, that's great. So shout out to my friends at Esperanza. I am a huge fan. I am in your fan club. Really enjoy working with your leadership team, in serving the needs of individuals in the state of Pennsylvania. Esperanza is a phenomenal organization, and I'm honored to call you a friend. So while we're waiting for the next slide, I want to talk for just a moment. There we go. So many of you may be aware that in February of 2023, an eastbound Norfolk Southern train was in eastern Ohio, crossing into western Pennsylvania, and unfortunately suffered a derailment. And the community that we serve on the Pennsylvania side of the state line is just really a mile from where the train derailment occurred in Ohio. And I was incredibly honored to have received a call from our partners at the Department of Health in the state of Pennsylvania, asking the FQHC to help provide care for first responders and individuals in the community that were impacted by the train derailment. So, of course, when I got the call, I said, sure, we'll be there, we'll go. And before we deployed, we thought, well, we need to learn as much as we possibly can about what we're getting into and how can we best provide care to individuals in the community. So we conducted educational sessions for our staff and provider as we were in the process of deploying. And we made a commitment to the individuals in the community that we want to ensure care from both a behavioral health as well as a medical standpoint on the ground at the site of the train derailment in the community, but that we're not going anywhere and that we're here to take care of you even after the immediate impact of the train derailment. I'm proud to report that in the time that we were on the ground, we were able to successfully care for 149 patients. The vast majority of them had minor clinical manifestations, but the majority of them really were anxious. And they wanted to tell their story. They wanted to make sure that they were checked out, and they wanted to make sure that we would be there to care for them even after the media and the press went away. It was a really tremendous opportunity. Next slide. Lessons learned from our emergency response. We wanted to develop and have developed a deeper understanding of the community that we serve. I'm a physician, and I realized that no one ever taught me in medical school how to care for first responders or residents of a community who may have been exposed to a toxic plume after a train derailment. And very shortly after the train derailment, we here in Western Pennsylvania encountered significant thick smoke from the Canadian wildfires, right? And it occurred to me, guess what? They never taught me that in medical school either. I did go to medical school, by the way. And then shortly after that, we experienced significant heat from the heat dome that was present at that time. And it really occurred to me that I'd like to commit to those first responders and the residents of the community to learn as much as I possibly can about the impact of our changing environment and the impact of extreme weather on our physical, mental, and emotional health and well-being. So with that, we have created a learning collaborative in partnership with Penn State University, University of Pittsburgh, the Pennsylvania Department of Health, a learning collaborative through what's called Project Echo, so that we could collectively learn as much as we can on how we can help our communities deal with these extreme weather events. Next slide. This is just, again, some photographs as we have deployed our mobile health unit. And I mentioned before that our current effort, we've also now embraced the opportunity for harm reduction as we take our unit into public housing and other communities within our community where there's a high prevalence of overdose and substance use disorder. Next slide. So you may recognize the guy in this photo. I was really honored in February of this year. I got a call from the White House that the president was returning to the site of the train derailment, and he wanted to take an opportunity to thank the first responders who were on the ground to care for the residents and that community. It was perhaps one of the greatest honors of my life to be able to meet President Biden and his team. And he was there really to express his gratitude for the work that the first responders and the FQHC did to care for the community. Next slide. But it hasn't stopped there. We've continued to advocate for the health center mission. These are just some photographs of us visiting Capitol Hill on Advocacy Day during the time that community health centers were in Washington. We had the opportunity to meet with many of our legislators and representatives to advocate for the mission of community health centers. Next slide. We're also really trying to be part of the conversation to address maternal health disparity and other issues related to health inequities in the state of Pennsylvania. I was honored to serve on a panel to try to look at opportunities to address maternal deserts and other inequities in women's and maternal health care. Next slide. Thank you. And now I'll turn it over to Tina Adamson.
Hi, everyone. Well, thank you all for your time and for attending today. And I'm really excited to share some more information about our journey and sort of the meat and potatoes of the specifics of some of the programs that we've been doing when really turning our focus on to creating a resilient workforce. So in addition to all the great things that Dr. Garrow mentioned, I'm really excited to share some of those programs that we've really focused on developing over the last few years. So if we want to take a peek at the next slide, I do want to start off by saying, this slide really, there's a lot of information on here. I will go over and highlight each one of these areas of focus. But I do want to start by saying that this was something that really evolved over the last few years. It wasn't something that we tried to implement all at once. It's really been something that we've taken our time. We've had opportunities to listen to our employees and really dig into the data. And so I saw Foster had shared with us in advance of this presentation some of the questions from our participants today were, where do you start? Where do you begin? What was sort of that piece of information that you used? And what I would say in our situation was data. So I'm going to share with you some different data points maybe that you could start with at your own health centers. And really that told a story to me and to our team about where we start, what our employees really wanted from us, really needed from us, so that they could focus on taking good care of our patients. So we're going to talk a little bit about education and skill building, workforce pathways, and wellness and community building. And so that's really just our theme is to create an environment of continuous learning. But that's in addition to a lot of other things, a lot of other programs, a lot of benefits and analysis and all those other great things that happen at our health centers behind the scenes. This is just one particular area that we wanted to share with you all today and to focus on. So I can't wait to hear your feedback on some of the things that you're doing at your health centers as well, because I mean, honestly, you get inspiration from everywhere, right? So if we want to go to the next slide, I believe we have a Slido of what continuing education or professional development opportunities does your organization offer?
Again, we think we have fixed this issue, but if not, please, I will be happy to read out these results and we'll share them in the chat. But yeah, what continuing education or professional development opportunities does your organization offer? And this can be a wide range of different opportunities. And we have some good stuff pop in. We're going to copy and paste that into the chat. And I think we can just move forward and we'll share those responses that we got.
Awesome. Sounds good. Thank you.
Sorry, Tina, and thank you all again for your patience.
Yeah, no problem. I can't wait to see what others are doing. So I think I was most excited about that. So this is just a wonderful chart that highlights some of those areas that we're going to talk about regarding continuing education and learning opportunities at PHN. So if we want to skip to the next slide, that's where we really get into the details. So support for formal education. I'm sure, like a lot of you, we have tuition reimbursement programs. And so we sort of have two different areas that we focus on. One is that management tuition. So in our positions here at PHN, to be in a manager or a director role, we do require that you have a bachelor's degree. And but we also recognize that not everyone maybe has that background just yet, and we're willing to support them in the process of obtaining that. So maybe our policy currently says that within 1 year of them transitioning into that management or director role, that they would begin their education process if they don't already have that qualification. So specifically for a management tuition, we do pay 100% of that tuition for our managers. For employee tuition, we've offered $2,500 for as long as I've been with the organization, which is a little over 12 years. And just last month, we received approval to increase that to $5,000 per year. So we really think, again, our commitment moving in that direction, that we want to support our employees. The only stipulation that we have really is that it needs to be in a degreed program towards something that they could do at Primary Health Network. So, that could be in many different things. That could be in human resources, that could be in finance, accounting, it could be in business management. So there's lots of different opportunities that folks can get further their education. And we do cover other educational things. So if someone wants to take, maybe a leadership course that's going to take 3 months or 6 months, that's something that we could consider under our employee tuition as well. The other thing that we really took a step back, maybe a year or two ago, was removing degree barriers in some of those positions. So we were receiving applicants, which we all know how hard it is to find good qualified people to work at our health centers. And we were receiving several from people who said, I don't have a high school diploma or a GED. And your positions all require that. And we really took a step back and said, is that really necessary? Or is that something that we could still employ folks in some of the positions and support our employees then in obtaining their GED or their diploma? So we went through all of our job descriptions and removed that barrier from some of those positions where we said that's really not necessary for them to have that high school diploma or GED. But what we do want is for folks who are joining our organization to commit to obtaining that within 1 year of them being hired with the organization, and we will help them, we'll support them. Assistance with the financial barriers that may come with that as well. And so we've had a really great response in sort of removing those degree barriers in some of those positions. Next slide.
We have a really great question in the
Yeah.
chat. Betsy says, I love these ideas, and I'm wondering if people can share how they are paying for some of these new services, benefits, etc. Our
Yeah.
financial situation took a real hit over the COVID years, and I'm trying to imagine what rock I could look under to figure out a way to fund some of these things.
Yeah, a really good question. Some of them were things that we were able to budget for in advance. So what I did for the most recent employee tuition reimbursement increase is went back and looked historically how many people we typically have submit for that tuition reimbursement. And this is something that we've committed to from a leadership standpoint. So we may also recognize that maybe there are other areas within our organization that maybe we have to cut back or reduce in order to meet the commitment that we have for this particular area. So that was one of the things that we chose to do. We chose to reduce our budget in a particular area for posting jobs online in order to be able to support some of these programs. So for us, we did it in advance to make sure that it was part of the budget moving forward, which again, I know may be difficult in some situations. And I am going to highlight on the next slide, maybe some additional programs and how we've been able to continue with some of these programs as well, with grants. And so we've been extremely blessed to have grant opportunities that will help to support some of these programs. That might be an opportunity. My understanding is it appears to be more and more grants are forthcoming to help with workforce development. So I hope that's an opportunity in your area as well to help with that, to support that. So medical assistant training was, and when we get to the next slide, we'll talk about that as well. But medical assistant training and dental assistant training, I'm sure like you, we struggled to find candidates, applicants who were qualified to come to our organization to fill those positions. And so we recognized the need to do something different. It was difficult with some of the other organizations in the area, especially during COVID. A lot of those schools closed. And so we didn't have that feed that we used to have with schools in the areas that were training students to send to us. And so at that time in late 2021, early 2022, we decided to partner with an organization called NEMA, which is, you can see the information here, and National Institute for Medical Assistant Advancement. So it's a great program for our organization. I know there are other programs out there that are very similar to this. So I would encourage you, look and see maybe what's the best fit for your organization. We had received a very large grant at that time coming out of COVID that has been able to support this program for the last 2 years and actually will continue into summer of next year as well. So we took the opportunity when we received that grant to move forward with this program. And I think it gave us a great opportunity to get our feet wet, to get the processes and procedures in place that we needed. So now that we have that in place, I feel like this is really a program, again, that we've committed to continuing. And I'll share some of the results with you as well. But I think, growing our own basically was the best option for us coming out of COVID and moving forward as well. Not that we still don't partner with other schools or have other opportunities for hosting medical office assistants going through training, but this was a great opportunity for us to sort of grow our own. And so we've had 4 to 6 participants, or we try to have 4 to 6 participants in each cohort. There's 2 cohorts every year. And we've graduated 18 people since the spring of 2022 with 100% retention of those people, which is why we are so committed to this program, because it works. And so what the program looks like for us is that we may have someone in an entry-level position like a front office assistant. We hire them as a front office assistant full-time. And if they express interest in increasing their skills or maybe transitioning to medical office assistant, PHN pays for the full cost of that, which is, you see here, is around $6,850. So PHN pays for that as long as the employee is given the commitment that they will stay with the organization for 2 years after they finish the course. Otherwise, they have to repay that money back. We have a wonderful team of clinical trainers that are really the preceptors that are on site. So if you're not familiar with the NEMA program, they do a lot of their learning virtually with the school. So someone from the school is teaching them the information that they need to have, but their hands-on piece is at our sites. So although they are hired full-time as a front office assistant, we do allow them time in the back, in the clinical space, so that they can do those skills and become comfortable with them. So it's really been a great program. The folks that have gone through it really have great positive things to say about it. And again, it's creating those pathways for our employees to move into different areas, to increase their skills, and continue to advance in the organization. So on the next slide, I had mentioned briefly about the dental assisting training. Again, we had NEMA, so we were excited about that. We were moving in the right direction, but we kept saying we cannot find dental assistants anywhere. And again, probably like many of you found during COVID, those schools closed that were training dental assistants. So we came back to the same model that we had with NEMA and said, what can we do? How can we develop our own dental assistants in-house with a partner organization? And so one of our friends from the community health centers in Pennsylvania recommended this career step for developing dental assistants. So they have a great program that the employee, again, we would hire them as an entry-level employee, like a front office assistant. This program's a little bit different, where they do most of the training on their own, most of the learning on their own outside of the workplace. But we support them then with the competency and the hands-on piece so that they can get comfortable with the information that they've learned. The cost for this is significantly less. It's $3,000 per student. Again, same thing. If the employee has committed to that program and agrees to stay with the organization for 2 years, then we would pay for the full cost of that. If not, they would have to pay that money back if they leave before that time frame. So the dental assistant program has been wonderful for us. We've had 3 people complete it already, and 2 more have just signed up for it as well. And this program allows a little bit more flexibility that they can sign up at any time. So it's not like NEMA, where it's just the 2 cohorts per year. This is a program that has a little bit more flexibility, that people can enter that program at any time. So again, we've had really great success on this dental assistant training as well. On the next slide, we have skill building workshops that are, again, I mentioned we have a great clinical training team. And so we're so lucky that we have them. I know a lot of organizations don't have access to that, but we have a lot of really skilled folks in that department that put on this annual skills workshop for our employees. And so all of our employees go through this annual skills workshop. It's for clinical, dental, front office staff. Again, it's facilitated by that team of trainers who are subject matter experts. And the workshops are specific to the staff who share responsibility or area of work, including managers. So if we have managers who are LPNs or RNs, they would also go through this skills workshop. And you can see some of the training topics that are included that we go through during that training. It usually takes a few hours to go through. It's really a great review of the policies and procedures. We know that sometimes when staff get to the sites and maybe they forget, oh, I forgot this one step for this policy or this procedure when I'm doing, this process. So it's a great reminder annually, and it's really helpful when we're reviewing our information with HRSA when they come to visit, as well as when the Joint Commission comes, that we can show this is how we make sure that our employees are competent to be taking care of the patients in the situation that they are in. So we offer a skill building workshop. On the next slide, I believe we have another Slido.
We are officially abandoning the Slido. Thank you all for your patience. If folks just want to put in the chat, are there any education initiatives or programs you would like to see at your organization? Either continuing or something new? We would love to hear from y'all. But yes, apologies for the Slido issues. As we said earlier, this is webinar 16, and this is the first time this has ever happened. So apologies again. And we'll give it just a moment to hear from folks in the chat. And we'd love to hear from y'all throughout. So Tina, I think you also should feel free to keep going. And if folks share, we can, at the end of this section, kind of bring all these pieces together.
Sounds great. Yes. Okay. Well, on the next slide then, we really recognized, and this sort of came about with looking at the data with our turnover, which I'll get into in a few minutes here. We recognize that our managers and our leadership at our organization really have a huge impact on employee engagement. And so we knew we needed to focus more on our leadership and management training and development. And so that's how some of these programs were born. We have the HR workshops that you see here. They're monthly, they're on Zoom, especially since we're so spread out. And we just use the expertise within the organization and or videos or other professionals to share information or education with our managers. And some of the topics that we talk about during those sessions are just performance evaluations, doing performance evaluations appropriately and what those look like, disciplinary actions and how managers should handle those. Jessie, which you'll hear from in a few minutes, she's going to talk this Friday about engaging quiet quitters. Employment law basics, which is great information for your managers to have, emotional intelligence and managing different personalities, recruiting, interviewing, non-apparent invisible disabilities, and making your meetings more productive. So lots of different topics that we try and cover. It's just once a month. It's for 1 hour. And we also record them. So if our managers aren't able to attend, that they're still able to reference that. And it's created a great library. So when we have new managers joining us, we can refer them to that library if they have questions or want some additional development. We want to make sure that they have lots of opportunities and access to that information. The annual leadership summit was so much fun. We brought all of our managers together, which we have nearly 100 managers in the organization at some level in there. And so we recognized that they wanted to be together in person. And so I believe that was the first time we did it earlier this year. That was the first time that our managers had been together since prior to COVID. And so it was a great opportunity for for us to get together and just highlight some information, some things that were going on in the organization. We're going to be having another session, Management Keys to Success, will be happening in October of this year, again in person. And at that session, we will have our in-house experts talking about fiscal management and budgeting, risk management, Joint Commission, HRSA, preparedness. We're going to do team building activities. We'll have our informatics and IT team talking about cybersecurity and all of those things just from a management standpoint. So again, giving them the tools and the information that they need to be successful in their roles, because again, they have the biggest impact on our employee engagement. And I did include some costs in here. I tried to do that on some of the slides just so that you could see that. We try to keep it fairly minimal, just the cost of to rent the space to accommodate the group that we have, plus the cost of food. So we do try and keep that at minimal cost. On the next slide, these are some of the things we're so excited about. The Leadership Book Club was something that Dr. Garrow and I had talked about for a few years, and we finally said, let's do it. So Dr. Garrow and I lead the monthly book clubs. And so really there's usually between 10 to 20 participants for each book. We usually send it out annually. Here are the books that we're going to cover this year. Pick which one you're interested in participating. And we purchase the books for those folks who are participating in that. And then we spend 1 hour per month together with the team reviewing that section that we've decided assigned for that month. And we have learned so much, not only from the book, but from each other, and also made a plan for how do we continue this after we finish reading this book and this great information that we've learned. What are some things that we can put into place to make sure that we are able to spread this out? So I've listed some of the books here that we've already reviewed. We just wrapped up The Resonant Leader, which was fantastic, and we will be getting ready to start on another one here coming up. And so it's just for minimal time and minimal funding to do that. It's a great opportunity to continue the leadership development in your organization. We also offer a mentorship program, which allows executive, senior director level people that they are available to partner with other levels of management or employee levels. So if you have employees that are interested in developing their skills in the organization or want to move into management positions, it's such a great opportunity, and it's such a wonderful learning experience, not only for the senior leaders in your organization, but for the other levels as well, to get to spend some time, develop their skills, learn the ins and outs. We really set the initial time frame of a 1-year mentorship, but it could be less than that if they feel like, hey, I'm good. I feel like I have the skills that I needed from you. Or it can be longer if it needs to be longer, or it can change people. So it may be someone may be with me for a year, maybe with our senior director of operations for a year, maybe with someone else for a year. So there's lots of flexibility in that program. And it's something that someone could say, hey, I would love to participate in this. Or it can be something that maybe as part of their goals for the next year, their manager recommends that they be part of the mentorship program. So it's a really great opportunity, again, for folks to take advantage of. On the next slide, I want to briefly share my story with you. Just so that you can see, I know there's HR folks on this call, so I wish I could see your faces, but I'm thrilled to share my story. Probably like you, been in HR for a long time, a little over 25 years. But these are just some of the things I feel like it's important for me to show the team that I'm committed to continuous development for myself and for them. And so one of the ways that I do this annually is attending the SHRM conference. That's something that's really important to me. It's something that Dr. Garrow and I have talked about and committed to. And not only is it a great learning opportunity for me, but I bring that information back and I share that with the others in the organization. And, it sort of renews my soul every year too, which I'm so thankful that Dr. Garrow supports me in that endeavor as well. The other thing that I had no intention of ever doing, but recognized about 2 years ago, was that I was missing pieces of my education that I felt I wasn't being a great business partner. And one of those things that really I felt would be helpful to me was to obtain my master's degree. So I did obtain my master's degree through the University of Phoenix. I went through their competency-based program, which takes 1 year. And you can see the cost here, which was for master's degree, I feel like was fairly minimal, but really had the support of Dr. Garrow. And I loved that learning experience and couldn't wait to get back to the office and to share that information that I was learning as it was happening, and felt like I really, I feel much more confident in my abilities to support the organization, not only in my HR role, but also as a good business partner. And the HR team development, you'll get to hear from Jesse, who is just a fantastic member of the HR team. But one of the things where it sort of started a few years ago was I started a book club for the HR team. And so I also oversee our credentialing teams, our clinical training team, and our foundation. And so as part of the larger team, I decided that I wanted to invest in my team's development outside of all these other things that were taking place. And so we meet as a team virtually once every other week for 1 hour. And as my gift to them during the holidays, they get a book. And so I choose the book, and that's their gift every year that I purchase for them as their gift. And that's something that we review together. And I want them to know that I'm invested in their development, in their leadership skills. And so we've talked a lot about different books, and we try and pick different topics every year, but it's important for them to see that not only that I'm continuing my education, but I want them to see that I'm invested in theirs as well. And so on the next slide, I know we have lots of information to get through, so I don't want to take too long, but these are some additional workforce pathways. So recognizing that, again, we had some grant funding that would assist with the community health worker development. Like many of you probably have community health workers. That was a new program a few years ago. And so a lot of them have their certifications, but we recognize that there are a lot of people who are really invested in the community, who are connected, and those are the people that we want working for our organization. Even if they aren't certified as a community health worker yet, we can bring them into the organization as a community ambassador, support them during their training time that they need to become a certified community health worker. And so that's how the community ambassador position was created. We also love students and interns. We provide lots of opportunities. We have over 200 students every year that come to our organization that spend time, and not only in our clinical sites, but also at our HR department, in our communications team, in our finance team. So we love to have students. It's a great opportunity to build relationships. It's also a wonderful recruitment tool, and it provides teaching opportunities for the staff who enjoy doing so. And then the diverse, equitable, inclusive recruitment and promotion. So these are additional programs where we recognize maybe folks don't have quite the skills that they need just yet for those positions like a practice manager. But again, they are committed to the mission, they believe in what we do, and they would be a great person to be part of our organization. So again, developing more pathways, more development opportunities for folks who might not have those skills, but that we can help to provide them in the organization. On the next slide, we will talk a little bit about succession planning. So this was something that we did in-house 2 years ago, and we started with the executive leadership team. And so I worked with each member of the leadership team to identify 1 to 3 people in the organization currently who may be people that we want to focus on developing, increasing their skills, preparing them for that next step in their career. And or identifying that maybe there isn't one currently. And what are we going to do about that if we don't have someone in-house currently that we feel is ready for this next step? For those people that we did identify that were already in the organization, we said, what are 3 to 5 goals for this next coming year that you and this employee can be working on together to develop those skills? I mean, this may be something that takes 10 years before they're ready for that succession planning to happen, but they will have the skills and abilities needed. So also involving the board to complete the succession planning for the CEO, just so that, we're ready to go in the event that someone is retiring or someone wants to transition out of the organization, that we have people who are sort of ready to go and have the skills and abilities that they need to move into that next step. Okay, I think we have the next question. Do you just want me to keep going and people can put the info in the chat?
I think we'll give this just a moment for folks to share anything in the chat, but not too many moments. And then we can share out those answers as they come in, and can also continue moving because I know y'all have a lot of great things to share today.
Gotcha.
But we were specifically interested for y'all. What does recruitment look like at your organization? And where do you see those as strengths? And where is there room to grow? And so, again, the Slido has been retired for today, but we would love to see those answers in the chat.
Yeah.
And Tina, someone had also shared before that they, again, appreciate that, like, the naming of the resources for funding. That's a very helpful piece of this.
Yeah.
And someone just shared that they utilize the whole team to brainstorm on who we know or who we can tap for applicants.
Yeah. Isn't that a great opportunity to, rely on the people that you have on your team? Where do we look? And it's changing. The ways that we had historically recruited people in the past has changed. It looks very different than it looked before COVID, for sure. And going through where really the limited resources that we have and, changes to those platforms, it's never something that you can sort of say, oh, well, we got this. We're getting plenty of applicants coming through. No doubt it's going to change if you give it 3 to 6 months. So, okay. Do we want to move on to the next
Can
slide?
move on.
Yeah. Okay. So these are our diversity, equity, and inclusion organizational goals. So this, again, was another area that we really dug into and really focused on over the last few years, and have created a DEIMB committee that helps us to support these goals and to make sure that we're always keeping a beat on what's happening. How are the things that we are doing moving us towards meeting these goals? So I'm not going to spend too much time, but I do want to highlight the very first one: enhancing the education and training to all PHN staff and leaders, focusing on that diversity awareness and sensitivity. And just want to point out one really great tool that we've utilized is the NAC, Racial Justice and Cultural Humility Training. It's a fantastic training. If you haven't had the opportunity to see it, it's free. So I encourage you to take a look at it. It was such a wonderful learning experience for our leadership team to do together, and now rolling out to all of our employees and in sort of bite-sized pieces. But great opportunity, and again, to take advantage of something that doesn't cost anything. And NAC did a really fantastic job with that. So on the next slide, I want to just touch briefly on, again, going back to creating the resilient workforce. And one of the things that we do, zero to minimal cost on, is created the wellness committee. And this committee meets monthly, handles our wellness initiatives. They focus on emotional, physical, social, and financial wellness. So there's just lots of different things, events that we try to host, or especially because we're so widespread, to take advantage of using things digitally, or to have things posted on our SharePoint that we can share, or things that they can do with their teams together. So these are just sharing some opportunities there. I do see in the chat someone asked what resource was free, and I think going back to the last slide, it was the NAC, racial justice and cultural humility training. So it's on their website. That training is free if you want to take advantage of that. Okay, let's skip to the next slide of the monthly management meetings. This was just, we just hosted our monthly management meeting. This is something that all of our leadership has an opportunity to share what's going on in their areas, and make all of our managers across the organization, they're hearing the same information. So we share initiatives of what's going on, what's to come, what things we're focusing on. And I think it's really a great opportunity for our managers to be able to ask questions during that time as well about, these are some initiatives that are taking place, and I have a question about that. So great opportunities for those. So the next slide, I think, is a Slido again about wellness initiatives you want to start or continue at your organization.
And thank you for sharing the NAC training, Jessie. Love that.
Thank you.
I think we can just move forward here.
Okay, I
And
want to give lots of time for Jessie too, sorry. So using data to inform your strategy. So I'm sure many of you have so many different data points. This again these are just some on the next slide that, and we'll get into a few more that we really utilize a lot. Exit interviews, I know that's sort of the post-mortem after they've left, but it does give valuable information. So those exit interviews not only come through HR, but they also get shared with the member of the leadership team that oversees that person, so they get that feedback as well. Leadership rounds, which is so exciting. It was something that Dr. Garrow started when he transitioned into the role of CEO a few years ago. And he really made a commitment at that time to get out of the office and to go out and see all of our employees. And so Dr. Garrow, myself, and some members of our other leadership team have made the commitment to do this every year. So we go out to every single site, we meet with every single employee in every department, and we spend time talking about, what are the barriers that you're seeing? What tools or equipment do you need that you don't currently have? What things are going right in your area? And what can we do to better support you? And we have learned so much. I encourage you, if you don't do anything else and you aren't currently doing these leadership rounds, to do that, because you learn so much and gain so much information from your employees about what's important to them. And so I think this has just been really a game changer for us. In addition, things like engagement surveys, we do that once every 2 years. We feel like that gives us some time. We use the engagement survey first this year to get some information, and use that information from that engagement survey to build our questions that we intend to follow up on during the leadership round. So that's been lots of great information. The HRSA Health Center Workforce Wellbeing Survey, which was a few years ago, Dr. Garrow made a challenge to our employees that if we had 70% participation in that survey, he would do a polar plunge. And so I think you see the proof here that we met the 70% participation rate. And you can see Dr. Garrow jumping into the polar plunge here. And taking advantage. So again, these are ways maybe just of encouraging your employees to participate, and employee self-evaluations. Jessie's going to talk a little bit about stay interviews, so I'll keep moving to the next slide.
we can move past this one as well.
Okay, and just 2 more slides. So the additional data points that we look at, the turnover rate. I look at this every month. The uncontrollables, retirements, deaths, boomerang employees, new employees. This was a huge eye opener for us. So we looked at new employees and said, oh my gosh, 50% of our turnover in the last year were employees who had 1 year of employment or less. And then we started thinking, you know what? What about 6 months or less of employment? So we set goals of where we wanted to be and really focused on the onboarding, the mentorship programs, the support for our new employees, because we knew if we could get them past 1 year of employment, the retention of that employee goes way up. So your story, your data may tell a different story as well, but really great information. Knowing the cost of turnover of employees. What does your data say about turnover, like loss in certain departments? There's things you want to look at, like, are you losing people that all report to the same supervisor? It is a certain job title that you're losing. What are those demographics? What's the tenure of those people? And then look at your turnover probability. So, just being prepared for sort of that succession planning piece. What's the average overtime? If they're working tons of overtime, then the indication that they may turn over may be a little bit higher. What's their commute distance? So like us, if you're rural and people are driving an hour, maybe that's an indication that they wouldn't do that long term. On the next slide is just additional data in regards to the diversity, equity, and inclusion that you may want to just keep an eye on that may have an indication for creating a resilient workforce, what your diversity looks like, the education level, the turnover levels of your diverse population, any education or training opportunities. So lots of data that I encourage you. Again, I mentioned at the beginning when I first started talking that data is where we started, and it really told us a really great story and has given us the information that we needed to maybe convince others that this is important. This is why we need to look at this particular opportunity. So I'm going to turn it over to Jessie. Thank you all so much for spending some time with us.
Hey, good afternoon, everyone. Thank you so much for having us. In the spirit of continuous development and improvement, I get to talk about some of our future considerations, maybe some of the programs that we haven't quite perfected yet, but we're just started, or we're in the process, or we're in the piloting phase. So if you want to go to the next slide. So Tina had mentioned that our turnover data is something that we've really focused on and honed in on what that looks like in the first year of employment and the folks that we were losing, the reasons. And as she said, we do take a look at those exit interviews, but they're kind of an autopsy. People don't look at them as closely. That employee has already left the organization. And so we want to capture the information and the issues before they leave and try to retain them. So just actually, as of the beginning of this month, we've implemented our stay interview process. So our stay interviews, if you've ever heard of them before, it's kind of coined by Dick Finnegan. He wrote the book on stay interviews. So we based our model heavily off of his research. So they're completed annually with the employee's direct supervisor, and it's opposite of their evaluation. So we capture them within their first 6 months. In addition to that, we also do some spot checks in the first 30 days, the first 90 days. So we're getting multiple checkpoints in that first year, trying to reduce that turnover. And then at the stay interview, the one-on-one, they're asking questions like, why do you come to work each day? What do you look forward to? What are you learning? Why do you stay here? And when was the last time you thought about leaving, and what prompted it? And what can I do to make your experience better for you, and anything else that they want to address at that time? So this allows for a conversation that's not based off of the performance evaluation to be had regarding that employee's current state, their satisfaction. And then we do a projection whether or not we think that they're likely to stay within the next 6 months, within the next year. And those stay interviews are done with the manager, but they're sent by HR. So even though, we're not doing the stay interviews, we're involved in the process, we're reviewing them, we're tracking it, making sure that those are getting done on every one of our employees. And we're also coaching our managers. So if a stay interview comes back and there's some concerns, we're doing a touch point with that manager to discuss how we can help that employee, and if we can get them involved maybe in some of the programs that Tina had gone over earlier. Okay, next slide. So another program that I'm so excited about is our Certified Registered Nurse Practitioner Residency Program. Some of you might have heard of these programs or have one that's close to you from an institution, but we're really excited to start this actually coming in December to begin our process. But this will be a 2-year program for any family medicine nurse practitioner who's graduated within the last 24 months. And we realize that family nurse practitioners and any nurse practitioner coming out of training, they come with a varying array of experience as well as education. The level of education depend, on an online program versus an in-person, if they've been a nurse for 5 years versus 20. And we try to cater our onboarding experience to match what their needs are. However, we notice that some of the folks that are joining our organization might need a little bit more support than others. And we want to do them a service by giving them the support they need so they can be a fabulous practitioner in our network. So the way that this program will work is that it'll be a two-year long program. In the first year, they'll be spending much more time on the didactic side, education, development, working with the director and other preceptors, getting to spend time maybe in some different specialties, not just family medicine. So really making them a well-rounded, family nurse practitioner. And then moving on to the second year, we're going to transition back to kind of what our normal model is. The admin time being about 15% and 85% of the time seeing patients. And so the justification for the financial side of this is that the production that they do in their second year and the fact that we expect them to ramp up maybe a little bit quicker and see some more patients than they would with the additional support that we'll receive in year one, to justify the cost of them having a lighter patient schedule in the first year. So right now, this is our plan for the program. Like I said, we're kicking it off and opening our application in December, hoping for our nurse practitioner resident to be joining us in May or June. And we're kind of going to learn as we go. We've taken some lessons from other programs at Carlow University and how they've modeled their program. But we also are planning to appoint a CRMP residency director, someone within our organization. So again, going back to creative ways that we can take our current employees and providers and allow them to pursue things that they're excited about and to provide education to a new family nurse practitioner resident within our organization. Next slide. So Tina talked a lot about the NEMA program and just how fantastic it's been for our organization and the Career Steps program and really what we've seen that do for the workforce shortage for those two roles. The other thing that we think would be really fantastic and just a creative way to grow folks within our organization is to take these two programs and use them to develop managers. So a lot of you are likely in the same position we are, where when we're looking at maybe a direct practice manager at one of our offices, we find a fantastic LPN, RN, maybe a medical assistant that has a lot of years of experience. We're really excited about promoting them, and then we move them into that role, and they might not have the management skills necessary. And so, we're developing things like the HR workshops to support them. But another angle that we're interested in taking is to hire a candidate who already has those leadership skills, has some experience in a leadership role, maybe a business background where they've done some oversight, and hiring them and then using the NEMA and Career Steps program to give them that clinical piece. So we require all of our direct practice managers to be able to provide clinical support and jump on hands-on if needed. I'm sure those of you who have smaller health centers or rural practices can understand that need for a supervisor manager in that role to be very versatile. So we would like to use the NEMA and Career Steps training program and have them complete this within their first 2 years of employment. So they've gotten comfortable in the organization. They have plenty of time to complete these programs, since they're typically 5 to 9 months, depending on how long it takes you to get through the program. But they're able to do this. And so they'll have both sets of skills. They'll have the leadership skills needed to support our employees, and as well as the clinical skills, and able to jump in and help as needed. So this is something that we've talked about. It's kind of on our dream list of things that we would like to see happen in the future. Okay, I think next slide. So our behavioral health side of our organization has grown astronomically in the past few years, since COVID, coming out of the pandemic, and just the isolation that Dr. Garrow had mentioned at the beginning of the presentation. And so with this, we see that there is a lot of need for behavioral health staff, and behavioral health staff that have experience in behavioral health are able to provide the support to our providers and our patients. So with this being said, it's sometimes challenging in rural and smaller areas to find folks with that behavioral health experience. So we're hiring someone who's coming into a role and they're a great medical provider of care, whether a medical assistant, a licensed practical nurse, or an RN, but they haven't worked with behavioral health patients, and so it is very much a different role for them. And so with this change that we've seen, we wanted to create a program specific to supporting those clinical support staff that are going to be moving in to our behavioral health offices and providing those services. So what we've done is we've created this behavioral health preceptorship program. So any behavioral health staff that's new, we're actually working on it in a couple different counties right now. And their first 3 weeks, they're going to get one-on-one support from another staff member. And that staff member is someone who has been with our organization, who has really shown that they are well-versed in PHN policies and what we do as an organization, as well as comfortable in the behavioral health side of our organization. So the the preceptor communicates back and forth with our director and the practice manager, making sure that that employee has the tools that they need. So they kind of act as that in-between support for the first month of employment. And the other thing that we're doing is we're giving the preceptor a one-time payment of $250 just as a thank you for the additional support they're providing their coworker. And then we're really hoping that we are building these relationships that last well beyond this preceptorship, that they have this go-to person that they can call if they have questions, if they have concerns outside of their direct supervisor. So we started in 2 counties, and we're going to hopefully expand this. And if it, continues to go well within the behavioral health world, we'll take the lessons that we learned from this and implement it into other specialties within our organization. Okay, next slide. The AHEC partnership. So the Area Health Education Center, if you're not involved with your local AHECs, I really encourage you to get involved, and they are a fantastic resource. So this is kind of shifting to provider recruitment and how we can better recruit providers, specifically family medicine physicians. I don't think it's any secret. Family medicine physicians, especially in rural areas, are on the decline. We have so many that are aging out into retirement, and just not enough new coming into our organizations. And so I've been really fortunate with our Chief Medical Officer and Dr. Garrow to work with our local AHEC director in Pennsylvania, who's faculty at Penn State. He's given us some fantastic insights as to what would help us with this recruitment and really playing the long game. And so data suggests that the longer the rotation experience, typically about 10 weeks minimum in a rural area, it's more likely that the provider is going to come back and practice in that area. So it takes a little bit longer to make an impression. And I know sometimes those rotations are closer to 4 weeks. And so they're not really getting the feel for what it's like to live in that area and really what that community means. So we're working on creating a curriculum and an opportunity for students to work with multiple providers and have a little bit more of a robust experience. So we're going to be using and pulling in our community health workers and our community ambassadors. And they'll also help take a little bit of the burden off of the provider to, be giving all of the education and support to the student. We want to be using maybe some of our other resources. And so we want the student to go and go to community events with the community health workers, get to know what the resources are in that area. Again, so they have a really robust understanding of what it would be like to work in that area. The other thing that they have done at other AHECs is a research-driven project, taking a look at some of the ways that they can improve health outcomes in the area, specifically the social and environmental drivers of health and the barriers to care. So things as simple as looking at where that patient might buy groceries, what's available locally to them, social interaction opportunities, or even public transportation, or how patients can get to their appointments. So really doing a deep dive into the area, the community, and getting the student invested in what we're doing as a FQHC in the area. And so this would be a limited, zero expense. The one thing we have looked at, though, with regard to the financial considerations is blocking some of the provider time. So, that would be a loss of revenue time. If we decided to take some of the time for the provider, we've discussed perhaps a 30-minute block, an additional 30-minute block for every 8 hours that they're precepting a student. So depending on the session and the length, but this is a project that we're excited about. We've already identified one of our providers that we think would be great to pilot this with, someone who is really comfortable with students, who's taken students in the past, given great experiences. So we're really excited to see how this grows and changes, and really feedback from students too on what they think of the experience. Okay, next slide. So along with going with the provider theme here, is provider benefits and how we can be creative. You know, it's very competitive in looking for providers, from family medicine physicians, psychiatrists, nurse practitioners. And so one thing that we've taken a look at over the past year is how can we provide some remote work opportunities. During COVID, that was a time that, you know, we were doing a lot of remote work, you know, came back to office. And for a long time pre-COVID, we were doing remote behavioral health services to our patients. So telepsych is something that has been around for our organization pre-COVID and it's continued to be strong post-COVID. But with that, we wanted to see what this would look like for our family medicine providers. So we piloted this program with 2 family medicine physicians and 1 family nurse practitioner. And we learned a lot of different things along the way. We monitored the different regions and patient populations. So we did pilot this with these 3 different providers in 3 different counties. And we found that it really worked well for one of the physicians. His patient population seemed to really be on board with this. He continued to remain busy, and it's been quite a success. For the other 2, we found that there were some different barriers as to why this might not be a good fit. One being the patient population being a little bit more geriatric and not being as interested in the telemedicine services. And the second, a lot of his patients requiring some more complex in-person care. And so we're going to continue to see how we can implement this depending on what the patient population is, the region, what the barriers are. If transportation is a large issue in the area, just focused on trying to reduce provider burnout. And then if we continue to grow this program in the future, we would use it as a recruitment tool. The other thing that I think is really unique that we've been doing is to provide some opportunity for providers to invest in things that they're passionate about. So we have a new psychiatrist coming on board, and we've done this for a few other providers, and allowing extra time in their week, some administrative time for them to support and to grow new psych nurse practitioners. So this provider had expressed an interest in education and providing education. And since we're not an academic institute, we wanted to figure out a way that she could do that in the organization. And so she's going to be providing some different lunch and learn, some support for these providers. So it goes both ways. You know, they'll learn from her and she'll learn from them on what they need in their new roles, and hopefully continue to support them. And then our family medicine physician, Dr. Garrow, did a great job of outlining our mobile unit and the exciting initiatives with that. One of our new family medicine physicians is very invested in community outreach and connecting us to different places that we can take that mobile unit and provide services. So just another way we're trying to support our providers in the things that really bring them a lot of joy. Next slide. So fostering workplace well-being. Myself and a couple other members of our team here at Primary Health Network had the opportunity to take part in the Institute for Healthcare Improvement's Joy in the Workplace training. So this training really focused on removing small and large barriers to try to help employees find satisfaction and joy back in their work. So I really recommend that course. It was fantastic. We have a lot of great ideas that have come from that. We've talked about creating some dashboards so people can see all of the things that we're working on, maybe behind the scenes, and really the ways that we're giving back and making an impact on the community. A few of my favorite things, that's going to be one of our tools that we use for engagement, making it so our organization has a place on our internal SharePoint where we can go and see some information about what people's favorite things are, favorite food, favorite movie. So if you're thanking someone, you can do it in a way that's tailored to them. Again, just trying to engage employees, foster relationships, have a positive environment, especially since we're so spread out geographically. Okay, next slide. So you might have seen on one of Tina's slides, Sean Aker is definitely one of our inspirations here at PHN. His Orange Frog program, based on the Orange Frog parable that he wrote, and his book that goes with that is The Happiness Advantage. He created this program that's really focused on just spreading positivity. So we're taking a look at maybe implementing this program or using it in one of our leadership book clubs. Also the Random Acts of Kindness Committee, Tina has been working on a fantastic proposal for that, really inspired by another Sean Aker book, Big Potential, but guided by the 7 steps to creating kindness and work in the workplace by the Random Act of Kindness Foundation. So we're looking at doing a monthly meeting, just sharing random acts of kindness that go on within our organization, giving ideas, sharing community service activities, photos, pushing those out to folks within our organization and beyond. So really excited about the opportunity just to spread that good kindness. Next slide. So our future DEI&B initiatives, we have just rolled out a ERG or Employee Resource Group survey. We have 74 employees already who have responded that are interested or very interested in joining an ERG. Really want to utilize those ERG groups in all of our DEI&B efforts, focus on recruiting diverse individuals and candidates, doing some culture sharing. We currently have a DEI&B newsletter where we do culture sharing highlights, so we love to do that, and then doing some specific trainings to the patients that we're serving. Okay, next slide. So I just want to briefly touch on AI. AI is something that we're very excited about. I think that there's a lot of fear surrounding AI, so we're excited to see what this would look like for our organization, implementing policies to protect our employees and our patients, but using it for better network communication, building presentations, maybe some of our social media and digital marketing campaigns, as well as some of our recruitment efforts. Really partnering AI with human interaction, emotional intelligence, but using it as a tool. Okay, and I think my last slide, thank you so much. Lastly, some additional initiatives that we're working on is mental health support and training. So we have some first aid training. Tina's going to be taking part in that to better support our employees and equip them, as well as some critical incident training. With some of the things that Dr. Garrow mentioned, we want our employees to be able to respond. There is a disaster for patients and staff, as well as very heavily focused on retention, pay equity auditing, and then finally, our leadership development. Tina mentioned the future events that we have coming up and book clubs. I think that is my last slide. Thank you so much, Foster. I'll turn it back over to you.
Yeah, thank you so much to the whole Primary Health Network team. Really appreciate your time and energy and sharing today. We would love to open stuff up for questions. Again, apologies, our interactive portions throughout were not as functional as we had hoped, but we would love to use this time to hear from folks on the call if they have any questions. We also have our evaluation poll for giving feedback on this specific training, and then in a moment we'll share our end of year survey. But for now, if you would like to come off mute and speak, you can raise your hand and I can press the request to unmute so you're able to actually talk to our presenters, or you can pop any questions into the chat. Either way, we'd love to hear from y'all. Thank you. And actually, a question that got sent in a little bit earlier, Jesse, was wondering about, in terms of stay interviews, have there been any concerns of staff being honest about why they might have left? And is there an opportunity for people to do those interviews with someone who's not their supervisor? Just thinking about those power dynamics, we wondered what y'all's planning for that had been.
Yeah, that is a great question. A lot of times people will say, why doesn't HR do the stay interviews? And the answer to that is that the direct supervisor is the person who has the most impact over whether or not an employee is going to stay or leave an organization. And so we do let our managers know and let them know during the training that if there is some kind of issue or reason that they should not be the one doing the stay interview, they can rely on their direct supervisor, just going up one level to have them do it. But we really want the direct managers to be forging those relationships because we anticipate that if an employee were to leave, that would have some role into why that they were looking for another position. Good question.
Yeah. And are employees able to request someone other than their direct manager, or is it kind of on the manager's decision on who does the interview?
Yeah, if the employee is requesting someone else, they're certainly able to do that. And then we would work with, maybe coaching that manager, the direct manager, on who would be the best person instead of them to do that stay interview. Again, likely the director or someone that was going to be able to get that good information as to how we can retain that employee.
Yeah, thank you. Um, Another question that just came in. How do today's presenters have time for all of the extra activities and all of the other parts of your jobs? I think both for y'all and for folks who do training at your organization, do you have robust support staff? What does that look like for y'all?
Yeah, excellent question. On a personal level, I'm so passionate about the resilience of our organization, and I have the opportunity to work with such inspiring people like Tina and Jesse, that it really isn't an effort to find the time. It's a good investment of my time, of our time as leaders of the organization. A little bit of preventive maintenance goes a long way. I certainly can attest to that with the oil change in my car. And I think investing time in our employees in the long run really saves us time over the long haul. So Tina, do you have any?
Yeah, no, I agree with that 100%. We are very lucky here at PHN. You heard from Dr. Garrow, we are fairly large, so we do have support systems in place. But again, we have so many people that are really passionate about it that, if we do an hour here or an hour there, we feel like it's not overburdening them. And really, unfortunately, or maybe fortunately, we tend to do it maybe during a lunchtime. So folks can just bring their lunch and we can meet over that time. So that's not, intruding on maybe their day-to-day activities. But we do have really good turnout for like the monthly meetings and the monthly lunch and learns that we have. So it doesn't appear to be too much of a burden at this point, but we have a lot of great staff who are really committed to the additional opportunities for learning. So.
I also endeavor to make it fun when I can. And now watch Jesse and Tina's eyes roll when I say that I often will begin a meeting with a dad joke. And so, really we want to make these events or these things that our employees look forward to. It doesn't always have to be doom and gloom, and we try to make them fun when we can.
Yeah, and what kind of feedback have you gotten from staff as these programs have started to be implemented?
Yeah, well, I think the great news is a lot of our staff and managers, again, we're face to face with them fairly often. We have lots of opportunities to hear from them, and the feedback has been really positive. And I feel like they also, because we've created that just culture, that they're not afraid to tell us if they have feedback on ways that we could improve it or things that we could change that would be more meaningful to them to engage them better. So we always, when we put something out, we always have the attitude that this doesn't have to be perfect, and it doesn't have to be something that stays like it is forever and ever. This can be something that changes. We are always open to their feedback, and I think our employees feel really comfortable with that. And they're willing to try new things and to participate. We have great participation with our surveys. I mean, we usually have 60 to 70% participation. So I feel like our employees really feel comfortable taking the opportunity to give us their feedback when they're able to.
Amazing. Thank you so much. And we are right up on the hour here. But as Josh shared in the chat earlier, Tina shared her contact information with us. And if you'd like to reach out to the team, they are excited to be resources. We'll also send out these slides and resources mentioned. And again, we want to thank all of you for being here. If you're able to fill out our end of year survey, this is feedback for the entire initiative, especially for those of you who have been able to make it to more than one of these webinars. We would love to hear from you. And just again, want to give such a warm thank you to Primary Health Network. We'll also be sending out the resources from the NHSC Empowerment Initiative. We have 2 specific resources, developing organizational resilience guide and a resource compendium. And so those will be updated and on their way out with our other resources as well. This is our last opportunity of the year, but all of our resources live on the initiative's webpage. You can find our webinars, our publications, all of the full recordings of webinars we've done this year with some other amazing speakers. And Josh just shared the webinar information and publications page in the chat. And this is the end of our year, but we have exciting things coming next year. So stay tuned and look out for our webinar schedule for next year and more information about those offerings. Thank you all so much. Have a great day.
Thank you.
Thank you.